All right. Good morning, everybody, and I wish that you're having a good morning, a good Friday morning, and today we will be discussing about scopes of theories and analysis. Okay, so this includes micro-range practice theory, middle-range theories, grand theories, and theory analysis and evaluation. Um, you know, you are still on your level one, okay? So you are still about to learn so many things, and we have to begin with the basic. Okay? So you will not understand complicated things, okay, unless you begin with the basic. All right. So this morning we will be talking about what is a theory, okay, and you will now start to meet the popular nursing theories. Okay. So we have we are conducting studies. We are a profession because there were people behind us who made or who discovered, who created theories that are helpful, to the entire profession as a whole. Okay, all right. So basically, we have to begin. Okay, we have to begin with the basic thing. So, what is a concept? Okay, so a concept is the basic building block of a theory. Okay, a concept labels a phenomenon, and a concept assists us in formulating a mental image about an object or situation. A conceptual framework is a structure that links global concepts together. Okay, so it's just like you already have a concept on your mind what things are all about. Okay, you already have a mental picture, a mental image, okay, of what an object is or what a situation is. Okay, so if you will be told about love, okay, you already have a concept what love is. Okay, so that is a basic building block of a theory. So a theory, a complex theory will never be made without the basic concept. Okay, so if Florence Nightingale then has made the environmental theory, it was because it could be that during her time she saw that the environment, okay, has an impact to a patient. So she had a concept what an ideal environment should be. All right. So what is a proposition? Okay, so a proposition is a statement that proposes a relationship between concepts. A proposition is the structural element of a theory, and a propositional statement in a theory represent the theorist's view of which concepts fit together. Okay, so if a concept is a mental picture or a mental image, a proposition is already a statement of what a theorist believe. Okay? So it's already a structured element. Okay, it's already the content, no, that the proposition, the statement that proposes a relationship between concepts. So if concept is one mental picture from the other, a proposition, okay, relates the two concepts. Okay, so from sentence 1 to sentence 2, it becomes a proposition. Okay, and what is a theory? Okay, so a theory is a set of concepts. This is a set of concepts and propositions that provide an orderly way to view a phenomena. Okay? The purpose of a theory is to describe, to explain, and to predict. A theory helps us to organize our thoughts and ideas. Okay, so theories guide research. Without theories, there is no backbone, there is no blueprint of an entire research book. Okay, so a theory, okay, is both a set of concepts and propositions, okay, that provide an orderly way to view a phenomenon. Because how can we understand a phenomenon? Okay, when we say a phenomenon, it is a study of um of something that is going on that we need to understand. Okay, a phenomenon of a thing. All right. So um because of a theory, okay, we are able to describe, okay, a certain phenomenon. We are able to explain and predict what will happen, okay, in the future. Okay, so it also it's also difficult if a theory is not organized. Okay, can you imagine a pyramid or a boxes of theory and then they are disorganized? Okay, so um you would be having a difficult time to understand things. Okay, so a theory should be organized. Your thoughts as well as your ideas should be organized. All right, so a theory is a set of concepts, definitions, relationships, and assumptions that project a systematic view of a phenomena. It may consist of one or more relatively specific in concrete concepts and propositions that purport to account for or organize some phenomenon. Okay, so you can just see in the picture. Okay, so we have a lot, people have a lot of questions. Okay? And as a human beings, we wanted to discover the answers to our questions. But in order for our viewers, for our readers, for our listeners to understand what we mean, okay, we have to organize our concepts, our definitions, the assumptions that we have, the relationships of each concept that we think in a systematic view. Okay, so there should be a systematic view, there should be an organization of thoughts. So um, your patience in itself can understand what you are talking about. All right, so what are the components of a theory? So these are the components: concepts, no? Ideas, and mental images that help to describe phenomena, by Ali Good and Mariner Tommy. And then definitions convey the general meaning of concepts, and then assumptions, statements describe concepts. Okay, so waray pa evidences, assumption mo pala. Okay, and then phenomenon, aspect of reality that can be consciously sensed or experienced. Okay, so importance of nursing theory. So theories provide a framework for thought in which to examine situations, and theories provide a structure for communicating with other nurses or other health team members. So along the way, when you create a nursing care plan or your plan for the duty, or your, if you are a teacher, the nursing care plan is equivalent to lesson plan. So you cannot go to the hospital without a nursing care plan. So if you do some procedures, if you perform some procedures to the patient, okay, for example, um, bed bath, or um, taking the blood pressure of your patients, there should be a rationale, no? A scientific rationale why you are doing such. And you have to communicate that to your other colleagues or other health team members. Okay, so theories assist the nursing discipline in clarifying beliefs, values, and goals. theories help to define the unique contribution of nursing in the care of clients, because we will not just clean the environment, okay, just because we are obsessive compulsive. But we have to clean the environment. We needed a healthy, clean, therapeutic environment, all right, so that that would aid into a faster recovery of the patient, because there would be less infection. Okay, so that is the basics of the environmental theory of um, Florence Nightingale. All right. So, scope of theories: grand theory, middle range theory, and micro range theory. All right. So, theory, one time, we had a quiz, and I asked the sophomore students, what is a theory? Okay. So, theory comes from the Greek word theoria, meaning to see. Okay? To see is to believe. Okay, so theory comes from what you have seen. So theoria. All right. And one student answered another thing. Okay, so it was very simple. Theory means theoria. So grand theory is a term coined by the American sociologist C. Wright Mills in the sociological imagination to refer to the form of highly abstractive or abstract theorizing in which the formal organization and arrangement of concepts takes priority over understanding the social reality. Okay. So example of a grand theory is the self-care nursing theory by Dorothea RM. Okay, so when you hear the word self-care theory, that only refers to one person, Dorothea RM. Okay, so she is a known nursing theorist. Okay, so also known as the self-care deficit nursing theory, focuses on the nurse's role in supporting the patient's ability to be self sufficient and responsible for their own care. That's why it is very important to feel beautiful. It is very important to take a bath. It is very important to wash your own teeth. It is very important that you care for yourself physically, emotionally, mentally, psychologically, okay? Spiritually. Okay? You have to discern what yourself needs. Okay? Especially if you are a nurse. You have to um, make the patient realizes that, you know, if a patient is not taking a bath because she's undergoing depression. So as a nurse, you have to work on the patient and day by day, hmm, try to encourage the patient to take a bath, okay, to feel beautiful, okay, to give light to a dimmed world or a dimmed face. Okay? So example of a middle range theory, Hildegard Peplow's theory of interpersonal relations is an example of a middle range descriptive classification theory. So middle range explanatory theories specify relations between two or more concepts. And another example is Ida Jean Orlando's theory of the deliberative nursing process is an example of a middle range predictive theory. Okay, so this is a structure of the discipline of nursing. So, nursing meta paradigm, you all have already learned person, environment, health. And in focus of the discipline caring in the human health experience, healing through caring. So we will have a lot of deterministic paradigm, integrative paradigm, transformative paradigm, and then grand theory comes first, okay, from the word grand. So it is more complex, it is more ambitious, it is bigger. Okay, the scope is bigger, the explanation is bigger. And then followed by the middle range theory, and then research tradition, and then practice tradition. Okay, so when we say practice tradition, okay, for example, we are already practicing in our communities. Basically, we get to practice the use of herbal medicines as medications to simple cough. Okay. So we will create a research that indeed lagundi leaves or sambung leaves can become a mucolytic, okay, um, in order for us to heal or to have less sputum. So we will create a research. After the research, if it is indeed proven, no, via evidences that sambong or lagundi leaves um, are therapeutic to a person with cough, then we will back it up with middle range theories and then grand theories. Okay. All right. So, knowledge development in nursing, the meta paradigm of nursing, meta paradigm concepts provide the boundaries and limitations of a discipline. Disciplines are distinguished from each other by differing meta paradigm concepts, and the major concepts that provide structure to the domain of nursing are person, environment, health in nursing. Okay? So these are always the four domains that you have to remember in TFN. Okay? Person, environment, health, and nursing. Okay? So what is a paradigm? Okay? So paradigm is synonymous to worldview. Okay? It is a particular way of viewing the phenomena of concern that have been delineated by the meta paradigm of discipline. Okay, so what is your worldview? What is a paradigm? How do you see the world? Okay, right. So what is a paradigm? It is a model that explains the linkages of science, philosophy, and theory accepted and applied by the discipline. Okay, by Alligad and Mariner Tommy. Alright, so what is a domain? The view or perspective of the discipline. It contains the subjects, okay, central concepts, values, and beliefs, phenomena of interest in the central problems of discipline. Okay, so how does domain relate to nursing theory? Okay, nursing has identified its domain in a paradigm that includes four linkages: person or client, health, environment, and nursing. Okay, so there is no nursing if there are no patients. Okay? There is no nursing if we do not know what good health means. Okay, and there is no nursing if we do not relate it to environment. Okay, so two individuals with different paradigmatic views can look at the same phenomenon, and each will view the phenomenon differently. The prevailing paradigm in a discipline represents the dominant viewpoint of particular concepts. So um just like a book. Okay. You look at the book or you watch a movie. Okay. You probably watch the Notebook, okay, or The Fault in Our Stars. So two individuals will have different paradigmatic views. Okay? We are watching the same phenomenon. We are watching the same movies, okay, or the same movie, but we have different interpretation of the meaning of the movie. Okay, so a paradigm revolution is the turmoil and conflict that occur in a discipline when a competing paradigm gains acceptance over the dominant paradigm. Okay, so a paradigm shift refers to the acceptance of the competing paradigm over the prevailing paradigm, or a shifting away from one worldview toward towards or toward another worldview. Okay, so It's just like there's a paradigm shift. If in 1950s or in 1900s we just had the basic belief of what health is, in the 21st century we already have a paradigm shift. Okay, because there are a lot of changes, there are a lot of improvements, there are a lot of new technology being given birth. Okay, so from one worldview to the other. Okay, so right now year uh, below 2020. Okay, so from 2020 to 2020 or 2020 to 2030, okay, we will have a lot of paradigm shift because we have already experienced COVID-19. Okay, so we will already know what to do when a lot of viruses will arrive. So we we have already practiced social distancing. We have been wearing masks. We have been wearing face shields. Okay, even if we are trying to live the new normal. Okay, so there's a paradigm shift. Okay, so two paradigms in nursing: totality paradigm and simultaneity paradigm. Okay, so nursing theorist Florence Nightingale considered nursing to be both an art and a science, stressed the importance of caring for the ill person rather than the illness, thought a person's health was the direct result of environmental influences such as cleanliness, light, pure air, pure water, and efficient drainage. Okay, so Florence Nightingale was focused more on the sick person, not the illness. Okay, that's why medical doctors or medicine is disease oriented. Okay, they will look for medications that will treat the disease. Okay? They will be advising or ordering um, medications or processes, or like for example chemotherapy, radiation, biopsy. Okay, they are more of the disease process and how to treat the disease. However, nursing, okay, for example Florence Nightingale, our focus is what the sick person is going through. Okay, how does she see herself in the midst of an illness? How do you feel when you have cancer? How do you feel when you have a chronic um, kidney failure? How do you feel if you lost your husband? Okay, how do you feel if you're being told that you only have 2 to 3 months to live? Okay, so our focus is the quality of life of the sick, that even if they are sick, we can still give them the best healthcare service that we can. That even if you only have 3 months to live, you are still able to experience a good life. Okay? Or even if you are sick, you can still live healthy. Okay? So, purposes of nursing theory: do you want to speak to the man in charge or the nurse who knows what's going on? So, um, ikaw, no? May pakiana ka, Hanners. So, you will be asking, um, why are you changing the linen of the patient? Why are you turning the patients every 2 hours? Why do we have to bathe the patient every day? Why do we have to change the diaper every every time it is full? Okay, what about the diet of the patient? Okay, and what about the manipulation of the environment? Okay, so ikaw, gusto mo ba mapakiana ha nurse nga waray idea, or gusto mo ito nurse nga nakaka-explain bisan ha iya um complexity of the disease of the person. Okay, so it pays to be speaking to a knowledgeable nurse. Okay, so the purpose of nursing theory is for you to understand that there are theories behind. Okay, for you to understand that things are deeper. Okay, a patient, okay, your patient may be having um, HIV. Okay, but life does not end there. Okay, they go through a process. Okay, they go through a lot in life, and we have to understand our patients. Okay, all right. So, what are the purposes of nursing theory? It guides nursing practice and generates knowledge. It helps to describe or explain nursing, enables nurses to know why they are doing what they are doing. Okay? So, why are you taking the blood pressure of a patient with severe cases every 15 minutes? Because, of course, if you will not take the vital signs every 15 minutes, what if biglang mag-stroke? Or what if tumataas na pala ang blood pressure? Okay? Papunta na siya sa um, heart attack o papunta na siya sa aneurysm. Okay? So you should be knowledgeable on the whys and why are you doing such and for what reason. Okay. So early nursing theorists are Hildegard Peplau, Virginia Henderson, Faye Abdallah, Joyce Travelby, Josephine Patterson, and Loretta Gerard. Okay. Contemporary nursing theorists Myra Levine or Myra Levine, Dorothea Aram, Sister Calyesta Roy, Martha Rogers, and Rosemary Parsay. Okay, so theories for the nurse worldview of nursing. They describe, explain, and predict the phenomena of concern to nursing from a more holistic perspective. So when we say holistic, we see as a person as a whole, okay, not fragmented. Okay, so the client has primacy. The client environment interaction is of utmost importance, and theories include those by Jean Watson, Martha Rogers, and Rosemary Parsay. Okay, so theory of human caring, developed by Jean Watson in the 1980s, offers a new way of conceptualizing human to human transactions that occur daily in nursing practice, composed of 10 curative factors which are classified as nursing actions or caring processes. So, with Jean, when we say theory of human caring, okay, if Florence Nightingale, okay, is environmental theory. Human caring theory is Jean Watson. Okay? So for Jean Watson, okay, she believed that it is not just the environment, okay, that will help the patients to be healed, but we also need to care for the human being. Okay? There are caring processes. Okay, you have to care for the human daily. Okay, she was focused on caring for the patients. Okay, she was more on the caring side. Okay, so the science of unitary human beings. This was developed by Martha Rogers. The person is viewed as a unified whole and seen as greater than and different from the sum of his or her parts. Okay, so ang iya pagkita ha human being bugos. Okay, diri la ha cognition, ha affective, dire la ha psychological, ha spiritual, ha physical, ha mental, emotional aspects, but as a whole, no, person as a human being. Okay, so the person is a human energy field that interacts with the environmental energy field, resulting in the process of life. So we live in the community, we live in an environment, we interact with other people. Okay, so that is a unified whole. Nursing aims to repattern the rhythm and organization of energy fields so that the person's integrity is heightened. Okay, so theories is knowledge that is used for practice, while process is the method to apply theory. Theory is the contents, process is the way of using that content. Theory contains concepts that are related in such a way as to describe, explain, or predict events, while process is the method of thinking about theory. Definition of theory is theories are invented to assist in describing, explaining, predicting, and understanding phenomena of concern in relation to research theory helps us to interpret scientific findings in a meaningful and general stable way, right? So theory is a systematic abstraction of reality that serves as that some purpose. A purpose of theory is scientific findings meaningful and generalized, efficient mechanisms for drawing together and summarizing accumulated facts from separate isolated investigations. Theories, okay, help stimulate research and the extension of knowledge by providing both direction and impetus. Theories provide a method of classifying and organizing data in a logical, meaningful manner, and levels of theory. In the preceding discussion, the basic from of a theory has been described as a means of starting relationships between concepts, and the theory may be commonly described as. Okay, so when you create a theory, it's creating a big box, and then after that box are small boxes. Okay, so you will explain the concepts behind your theories. Okay, so it's like a research. So you will draw things together, you will summarize your accumulated facts, okay, and it becomes a theory. All right, so there are micro theories, middle range theories, grand theories, paradigms, and meta theories. So micro theories are described by Neck as the least complex, from the word micro. Micro meaning small. Okay, so it begins with small ideas, or small theories are simple theories. Okay, they contain the least complex theories or concepts and refer to scientific, easily definable phenomena. They are narrow in scope because they attempt to explain a small aspect of reality. They are primarily composed of enumerative or associative concepts, while middle range theories, okay, from the word middle range, are theories at the next level of complexity. So, middle range meaning to say average level of complexity or difficulty. So, Moody or Cyrus Merton's definition of middle range theories as those that examine a portion of reality and identify a few key variables. Okay, so, Moody comments that middle range theories are often developed by qualitative or ethnographic studies in which data is collected about an area of practice or experience. Variables are concepts that are identified in the data, and suggestions, propositions, or hypotheses are then made about the relationship between the different variables. So when you go to research one on your junior level, you will understand these things better. Okay. So grand theories are the most complex and broadest in scope. They attempt to explain areas in a discipline, and they are composed of summative concepts and incorporate narrow range theories. Okay, so meta theory, which is the analysis of theory or theorizing about theory in a discipline, and meta analysis is a method made families in midwifery practice through the work of Inkin, who, with their colleagues, have brought together a huge amount of research in areas in pregnancy and childbirth. Okay, so types of theory. There are four types of theory that have been described by Dickoff and James, so two philosophers who have worked closely with nurses for many years. In their classic paper written in 1968, theories may either be descriptive, explanatory, predict it produces a prediction or shape reality. Moody summarizes these four levels of theory. So factors isolating theories, factor relating theories, situation relating theories, and situation producing theories. So, for factor isolating theories, observing, describing, and naming concepts, the first level of theory identifiers and describe or names concepts. So, Dickif et al. Describe this as naming theory and point out that if concepts have not been named, okay, so further levels of theory developed are impossible. So much of midwifery and nursing research is descriptive and aimed at this first level of theory. Okay, so kung what the if the basics are not yet named or if the basics cannot be explained, how much more the complex idealisms of theories. Okay, so factor relating theories relating named concepts to one another. These theories suggest interrelationship between concepts such as theories are often the outcome of qualitative research in which factor have been named and the relationship between them is suggested, and then so on and so forth. Okay, so these things you will understand better on your higher level. Okay, so right now, let us just focus on the paradigm of theory. So, what is a human being or a person? Okay, so it is emphasized that human or individual possesses unique potential, strives towards self direction, and needy stimulation. Whatever the individual does represent his or her best judgment at the moment. Okay, so self awareness and self confidence and acceptance are essential to individuals. Our sense of integrity and self worth. These circumstances require respect from the nurse. Okay, so for example, no, may da ka cough. Okay, and the only thing that you have is a lagundi capsule or lagundi leaves. Okay, so you will just opt to those what is available to you. Okay, so that is your best judgment at the moment. Okay, so self-awareness is knowing yourself, knowing yourself better. You have to be aware of your both of both of your strengths and weaknesses. Okay, and then self-confidence and acceptance. Okay, that is essential to an individual's sense of integrity and self-worth. Yung maramdaman mo na meron kang worth, no, meron kang you have a value. Okay, you're a person with value. That is a human being. Nobody wants to be treated unfairly, or nobody wants to be treated badly. Okay? Every person wanted to be loved. No, every person, even the worst people, okay, wants to be cared for. Okay, so these circumstances require respect from the nurse. As a nurse, you should not be biased. As a nurse, you should, you know, treat all kinds of people. Okay, so health does not define. Okay, however, supports the um, World Health Organization's definition of health. Health is a state of complete physical, mental, and social, spiritual well-being, and not merely an absence or distance or infirmity by World Health Organization. Okay, so type of nursing theories. Okay, we will keep on repeating things until you remember. Grand theories, okay, grand meaning big, broad, and complex. Middle range theories address specific phenomena and reflect practice. Okay, middle range, okay, on an average level. And the descriptive theories, first level of theory development, and prescriptive theories address nursing interventions and predict their consequences. Okay? So we will now go to the last topic, which is theory, analysis, and evaluation. Okay? So for the theory, analysis, and evaluation, okay, why on earth do we study nursing theory? Diba? Pwede naman diretso na lang mag-nurse. Diba? But how will you become an effective nurse if you do not know what you are doing? No? This is a process from first year to fourth year, so that when you become a registered nurse, you will understand a patient as a whole. You will be able to work efficiently. You will become a therapeutic nurse. You will understand a patient, a family, a community. Okay? So everyday practice enriches theory. Both practice and theory are guided by values and beliefs. Theory helps to reframe our thinking about nursing. Theory guides use of ideas and techniques. Theory can close the gap between theory and research and to envision potentialities. Okay? So we need to study, because if you will not study, doctors have been studying for 12 years just to be familiar with all kinds of diseases. Nursing has to be 4 years because we have a lot of clientele. We have a lot of patients, newborn, toddler, school age children, adolescents, young adulthood, middle adulthood, late adulthood, until death. Okay, so we need to study, 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 study. All right, so the study and use of nursing theory in nursing practice must have roots in the everyday practice of nurses. Okay, so it is our um, it is our weapon, it is our bullet. Okay, um, so that we would be able to overcome the everyday challenges. Because if you become a nurse, there are a lot of challenges in the world, no? Yung stroke, diri ito masarit. Uy ma, mag-i-stroke ako yan na. No? Okay? Ito mga nganak, diri ka masiring, ay ayaw laan ay panganak. Di ba? So we should be guided by theory. Okay? So that in everyday practice as a nurse, okay, we are guided. Okay? And we will always remember how to do things correctly. Okay? So, how do nurses use theory in everyday practice? Okay, organize patient data, understand patient data, analyze patient data, make decisions about nursing interventions, plan patient care, predict outcomes of care, evaluate patient outcomes. So, we will have an assessment, no? You will be asking the patient, what does the patient feel? Okay, bakit ba na admit ang pasyente? Okay, so you will be asking kung diri hiya nakakaoro, bakit hindi hiya nakakaoro? And you will understand that patient's data and you will analyze. So how can I help my patient so that I can promote bowel movement? Okay, and then you will be making decisions about nursing interventions, and then you will be planning patient care. Okay, until we evaluate the outcome and we will get a fine result or a favorable result on which your patient was able to defecate. Okay, so how do student nurses begin to use nursing theory? By asking yourself two very important questions. Okay? What is the nature of knowledge needed for the practice of nursing? And what does it mean to me to practice nursing? So, ada pa man kamuha level 1, gather the important details. Because, for example, TFN is your nursing foundations. No? It will guide you to higher levels of nursing. And what does it mean for you to practice nursing? Okay. All right. So nursing also utilizes non-nursing theories. So we should not leave home without the tender, loving care theories. Okay. We have to be loving. We have to be caring. We have to be um, people that is considerate, no? Understanding, kind. Okay, that should have been a nurse. Okay. So when you are wearing your uniform, you have to understand that people expects you to be kind. So commonly used in nursing theory, systems theory, basic human needs theory, health and wellness models, stress and adaptation, developmental theories, and psychosocial theories. Okay, so what is the link between nursing theory and the research process? So, theory provides direction for nursing research, and relationships of components in a theory help to drive the research questions for understanding nursing. So it indicates a spiral relationship between the two. Okay, so current trends that influence nursing theory, medical science, nursing education, professional nursing organizations, evolving research approaches, global concerns, consumer demands, and techno- technologies. Okay, so we are already very modern today. If you have a chance to visit modern hospitals, okay, and then nursing education has come a long way. In fact, we have journals, we have a lot of competitive nursing schools, and we have a lot of professional nursing organizations. So even nurses make their own researches. Okay, so globally competitive Filipino nurses, okay, is a choice by the world. Okay, and then of course technologies, right? So practicing nurses who despise theory are condemned to performing a series of tasks either at the command of a physician or in response to routines and policies. So kung diri ka maaram ha mga nursing theories, okay? Amo iton ginsistining na assistant ka la ka doctor. So whatever the doctor says, you tend to follow kahit mali, okay? Sunod ka pa rin ng sunod. Remember that nursing profession, we are independent from the medical practice. Okay? So we can function on our own, and we have a lot of ideas, no? Not just theories, but we have a lot of knowledge per se when it comes to taking care of patients. Or else, ginagawa mo lang yan kasi routine na eh. Or policy siya eh. Okay, so if you want to become a nurse, then be a good practicing nurse. Okay? You have to practice what you are learning. All right? So thank you, level one, no, for your time, and hopefully you have learned something about the scope of theories and analysis. So I'll be um, uploading the PowerPoint presentation because it is a pandemic, and some of you may need it. Okay, so also you can rewatch the video or you can download the video so you will remember. But the best advice that I can always give you is to read your books. Okay, to to read ahead, and to have your ledgers or your big notebooks. You always have to create your own notes because we cannot remember everything all at once. Okay, so your coaches, your lecturers, your advisors are just here. If you have questions, then you can message us on office hours. Okay, so if there are things that you want to be explained at, then you may do so. Okay, let's just maintain the professional gap. All right, so for now, I wish you all a happy Friday. Have some time also to recharge this weekend. And once again, this is Nurse MJ, your lecturer for this morning. Okay, so goodbye, everybody. Blessings, and keep safe always and stay healthy. All right, bye bye.